She was awarded the most innovative dentist of the year 2020 by Ministry of Health UAE, and is ranked top 5 best dentist by a survey done by Dr. Five. So she's extremely manageable, efficient in managing children with behavior, and adapts herself to treat every child in a customized manner as per the child's need, and has an experience of nearly a decade. So, Dr. Garima, we are pleased to have you to discuss today the issues and the concerns that the parent face with dental and oral related matters. Inviting you to start your presentation. Before that, I would also request the participants to engage in the chat. If they have any questions, they can put that in the chat. Even for parents who have Arabic questions, we have an Arabic colleague of ours who will help us to interpret the questions. So over to Dr. Garima for our presentation.
Hi, good morning, everybody. I hope you can hear me.
Yes, we can.
You can, right? So hi to all the moms who are here, all the parents, basically. So let me start with the presentation. I'll be sharing my screen. Stephen, can you guide me how to make it full screen?
Yeah, if you can go to the press that screen on the first stage, and if there is something at the bottom that go to present mode, can you scroll down a bit? I can only see the.
What if I do this?
Okay. I can see on the taskbar from the current side. Can you play the slide? Or there's
This
there's
one?
a play button.
Yep.
Yes.
All right. Great. So yeah, I would be minimizing this thumbnail out here. Yeah. So today's presentation is about oral care in children of determination or the special needs. So I am Dr. Garima Khandelwal. I have basically, let me introduce about myself. I have finished 7 years out here in Dubai as a specialist pediatric dentist. I've been practicing since day one I entered Dubai. I've been blessed enough to be in good job locations, and currently I'm practicing in 4 locations. 2 of which are in Al Barsha and 1 is in Festival City. And for all the children that would need sedation, we do that in Burjil Hospital in Sharjah. It's a very class hospital with all the facilities and a very good anesthetic team. So we are very comfortable operating, and so far I have done more than 300 cases under sedation in Dubai in all these years, and touch wood, all of them were fine, which includes the normal children, special needs, medically compromised. So if you want to find me, you can just type on Google my name and you would have my locations and ways to contact me. So now let's go to the presentation. I hope it's clear whatever I'm saying right now, correct?
Yes, it is clear.
Yes, great.
Yeah, it's clear.
Thank you. So what is special needs? Now, special needs, sometimes it can be congenital, which means that it's present since birth due to some problems that happened, or it can be genetic, or it can be acquired, which means that the child was born normally, but due to certain diseases or conditions or unknown reasons, later on, the child developed certain disabilities which have to be categorized as special needs. So with regards to the oral health, in either case, if it's congenital or acquired, it is different from a normal scenario. As in, when you try to perform the oral hygiene in such children, the most problem encountered, according to me, are poor cooperation of the child, because they just don't have the maturity to understand. They have resistance to mouth opening. See, even if a child is enabled to do a lot of tasks, but the lower jaw is always in the control of the child. And when the only movement the lower jaw can do is open and close. So anything foreign object going in the mouth, it's involuntarily the child would want to close. And now because there are teeth present there, and if you try to brush, there would be resistance to mouth opening, which would limit your ability to clean the teeth. I'm sure a lot of parents must have encountered this. Then there can be challenging behavior, or everything is fine and you want to just have a checkups or know more about the teeth, but you have a limited access to the dental service. Maybe the insurance doesn't cover, or maybe you're living in a place which is too far off from the specialist, because general dentists don't have so much exposure in treating specially able children, so they are often not the right person to give you a proper advice. So this is how I think most encountered problem. Is that true, or any parent wants to add anything more to that?
Yes, ma'am, you are right, ma'am.
You're right, correct? Okay.
Yes.
So I understand that in special needs children, it's a really huge task on daily basis to take care of their other bodily functions, that to multiple times in a day. It's like a full-time job, and every moment is like very important. You cannot be just relaxed and ignore at any point of time. It's exhausting and tiring. I do understand that. The only way to keep the child alive, especially for the children who are bedridden or can do some functions on their own, is to feed them. And that is also a very time consuming, as first of all you have to prepare different kind of food for them than the rest of the family. So you have like two tasks in the kitchen, and then you have to sit and feed them. Now, in such a scenario, it is understandable that the oral hygiene, due to various reasons that I've mentioned before, is not in priority. But let us understand why we are so much concerned about oral hygiene. See, if you can see this tooth, you can see this black spot, which commonly is known as a cavity. Now, when you say a cavity, what exactly does that mean? If you see the circle and the small circular things, they are the bacteria. Now, there is one bacteria in particular, which is called as Streptococcus mutans. Let me shorten the name for you. It's called as S mutans. Now, this bacteria is as such normally present in the mouth, but in very low numbers. So the body's defense can take over it. But when it starts to damage even one tooth, its number grows, because this cavity is basically home to this bacteria. And as the number of these bacteria grow, they start damaging more and more teeth. Now, if it was limited to just that, fair enough. But these are the same bacteria which causes so many problems. You see heart disease, strokes, lung conditions. Often, if you take culture, if any of a person is suffering from these conditions and happen to have teeth problems, you would find they would be the same bacteria which has caused the cavities. So you understand why these bacteria become so important for us. So but how did in the first place the tooth start to get decayed? That is the question. Like, we are taking proper oral hygiene, our child does not eat much sweets, and we don't give him chocolates, then how did the tooth start getting decayed? So it's not just the chocolates, the sticky carbohydrates, like for example, chips, biscuits, pasta, bread, they are equally culprit compared to a bar of a chocolate. So I'm not saying don't give these kind of food to your child, but limit their quantity. Give more of veggies, give more of proteins. Basically, anything that comes out of a packet should not be given, like the processed food, because they are loaded with sticky carbohydrates in direct ways or indirect ways. Now, what happens when food sticks on the tooth? These bacteria act on them and grow. And do you know how much time they require to grow? Just 20 minutes. Yes, it's so fast. So for example, you gave food and within 20 minutes, these bacteria would start acting on the tooth and create an acidic environment around the tooth. Now, once there is acid around the tooth is made up of calcium. It dissolves. Now, once it dissolves, a cavity starts to form. So what is the best way? As soon as you are done eating food, rinse them out. Don't let the bacteria have food as a source to grow upon. If there is no food sticking in the mouth, the bacteria cannot grow. I hope this is clear so far.
Sorry, I didn't get you. Can you explain again, or maybe in Arabic, please?
Can I have an ad? Okay, let me say some words in Arabic if you can understand. There is a tooth. You understand tooth?
Yes.
Now, you know what is soos?
Yes. I
No.
mean, like, yeah, once he eat these sticky foods,
Mhm.
then what he should do it?
Mad mad.
Oh, okay. Sure.
Madman.
Actually, he
Understood it?
don't do madmada, but he can drink a water maybe.
So what I can tell you, if he cannot do mad mad, you have a cloth, you know, a cotton cloth. You wrap
Okay.
it in your finger.
Yeah.
Dip it in water,
Okay.
and then you clean like this.
Okay, sure.
That you can do, correct?
Yeah.
Yes. So any other question before I proceed?
Yeah, my son, he can't put her hand inside her mouth.
But you
Even,
can put, correct?
yeah, I can. Even the brush, he eat it. He bite
Bite very hard on that.
too much, and he have a lot of the plaque in him teeth. All the doctor need to make surgery to make it under this sedation, but till now I'm not make it. I don't know what can I do after the food. Even what I do now, I drink him water maybe to make it good, yeah. But after that, no anything. I will try more time. No have
Do you
anything.
have bite blocks at home?
No.
Okay, after I finish this presentation, I will show you how a bite block looks like. So basically, it's a rubber-like block, and
Mm.
you open the mouth on one side. So the child cannot close now. Okay.
Okay.
So if the mouth is open, then you can
Mm.
brush. Because if you just try to brush, he will bite, like you rightly said, he will chew
Yeah.
on it. And then
Yeah.
you will get hurt, and it becomes a very traumatic experience to everybody.
Yeah.
So if you put the bite block, and it is a very easy process to put, I will show you on Google one of the pictures.
I
You
hope, yeah,
buy
please.
that bite block and place one side clean, place the bite block on the other side and clean.
Okay, I will try it. Yeah, if you
I
can
think
show
that's
me the
nice.
picture.
Yeah, I will share the picture. Once I'm done sharing the screen, I will share that picture and I will help you with that.
Thank you.
No problem. Any other question? No? Should I proceed?
Thank
Yes.
you. Yeah.
Okay. So see what happens once the cavity, or basically the soos, becomes big in size, it pains. Now, in a normal child, they would come and tell you my tooth is hurting. But in so many children, like the specially abled ones, they just don't know how to communicate that feeling. They might just start crying and you would not understand where it is hurting, you know. So this is an example of this kid whom we treated last month. She unfortunately has Rett syndrome, so she cannot talk or speak. She's 3.5 years old and she can just sit by herself. That's it. So when her mother came, she said, I don't know if my child is in pain or not, but I definitely see so many soos and the cavities in the teeth. So when we examined, we found 10 teeth having a lot of cavities. Now we decided to treat her because in my experience, all those soos were going in the asap, meaning all the cavities were going inside the nerve of the tooth, and there would be definitely pain, but somehow the child is not able to communicate. So this second picture is 1 week after we had finished the treatment. When she came for a checkup, my usual questions to the parents are, how is the child doing and is there any pain or something? So the first thing that mother said, doctor, my child used to get up in the middle of the night and cry in pain, and I used to not know what to do. And since 1 week, she's not done that. You know, that gave me so much of happiness because that means that was the cause of pain, that immediately as we treated, the patient stopped crying at night. So sometimes you just don't know why the child is crying, but because you are not knowledgeable about whether this cavity can cause pain or not, you don't think that it can be because of teeth. You understand? So
Yeah.
if you come for examination and the doctor finds that there is some soos or the cavity which is inside the tooth and causing a lot of pain, then you should get that treated and you will see a major difference, you know. So $1 million question, how to prevent it? You know, the first step to not go to the dentist is not have the soothe at all. So, but how to prevent it? So if there was a normal child, you can ask him just to rinse the mouth very often, but that cannot be done. Like all of you all said, the child does not know how to rinse. So simple method, take a cloth, wrap it around your finger after every meal, clean. Or take a soft toothbrush, put a bite block, clean from one side, change the bite block and clean from the other side. Okay, that
Okay.
should help you. Second thing, how to prevent is, this is a very good method that what am I about to tell you. See, all the molars, the behind teeth basically, they are big teeth. And if you can see, they have grooves like this.
Mm.
Now, this is the place where 99% of the cavity or the souse starts, because it's a ditch, you know, it's like two things are meeting and there is a small gap and it cannot be cleaned with brush. So what we do is we put a sealant over this tooth. Imagine there is a thin crack in the wall and you will put a thin layer of cement over it. So then nothing can go inside it, correct? So if nothing can go inside, souse cannot start. So this is called as a sealant. It's a very simple thing. You don't have to drill. We just clean the tooth. We put a thin layer of sealant and it lasts for 7 years. So even if you cannot clean the tooth properly, this will reduce the chances of having souse by like 80 to 90%. You can Google more, you can research more about this. This is a very, very commonly used method. So this is called as Pitt-Fisher sealant. Second thing is apply fluoride. Fluoride is like a painting on teeth. It just takes 2 minutes. You can do it even at home. You don't even have to come to me. You can come to me once. I will show you how to do it and you do it at home. So what is this? In Dubai, or rather in the entire Gulf, the water here does not have fluoride. A lot of Asian country has, and in US and other Australian countries, what they do is if they don't have fluoride in water, they add in the community water supply fluoride, because this chemical is very, very important for teeth development. If at your home you're having bottled water, see the contents. You will see fluoride mentioned, but it is 0.003. It is so less compared to 1 ppm. That is what is required. And the available here in Dubai is 0.003. So such less amount cannot help us in any way. So it has to come from outside. So what we have to do is we take this fluoride, which is a high concentration painting like gel. We apply over the teeth and we leave it there for 2 hours. So what happens? This fluoride makes the tooth a lot stronger. It takes all the calcium from the saliva and puts it back in the tooth, and it reduces the growth of those bacteria. So this is a very, very cheap method to stop having cavity. But how it is applied? You apply it once every 3 months. So basically 4 times in a year. That's all. So you can do this for your entire family. You can apply on your teeth also. You will see that you will not get souse if you take proper care, you know. So I have mentioned this link here. You can click on it and you can buy, or you can just come to me once and I can apply and show you how it is done. Is this clear? Understandable?
Yeah.
Okay.
Yes.
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 Third thing, GC tooth mousse. I don't know if you have heard about this or not.
Sorry, can you just can I see the link again, please?
Yeah, sure. We'll actually send you all the link. I think Stephen can send you all the links.
Sure.
So this is all available in Amazon, you know, this fluoride and this GC tooth mousse.
Okay.
Now, GC tooth mousse, first thing, if your child having dairy allergy, don't give. So keep that in mind. If your child is not having dairy allergy, this is again one of a very good things. So this is like a cream. You know how you apply moisturizer on your hand? You just take this cream, apply on the teeth and go to sleep. So this just has calcium, nothing else. So like I said, a soothe starts when the calcium starts to go out of the tooth. But if you keep on supplying calcium, the soothe will not start because the tooth is always protected. So once at night, if you apply and go to sleep, it has a very good flavor. There are many flavors available on Amazon or pharmacy. This is a very patented product by Belgium. No other company in the world can produce this because they have patented it, and it's a very, very good material. Try once. If your child is not having dairy allergy, if dairy allergy is there, don't give. And the last and most important, you must visit the dentist at least once in 6 months. See, I understand if the child is not having any soos that you can see, but we can make the very small soos also because we are trained to see. And it's not just the soos or the cavity in the teeth, the gums. You must have seen a lot of children have, thick or very fragile gums. Like if you brush, they will bleed, or you will see a lot of jeer or plaque or calculus over them. So gum disease is also very important because a lot of nutrients may not be always possible to be eaten by the special needs children, especially vitamin C. I have seen a lot of children having a lot of red gums because vitamin C is very deficient. And then the gums become loose. And so the teeth start to get more soos because more food gets stuck in between. And then you cannot clean. So if you keep on getting the children to us, first thing what will happen is the children will get used to us. So they will not have that much fear because we become a familiar face to them. And second, we slowly clean, so they will start understanding that they should not fear this activity. It is a simple cleaning from the dentist. And we can always tell you what things you are doing properly, or if there is something new in the market that they can help you. Sitting at home, you will not get all this knowledge. So once 6 monthly visit is mandatory for you to come and for us to see how everything is going. Now, what if your child already has deep cavities and he's having pain while eating, or there is swelling in the gums or on the cheek, or you see visibly the tooth is broken, now what to do? So how to treat such a child? Normally, you have to fully sedate such a child because cooperation is a big thing. And there are always more than one tooth involved, somehow, because we think, okay, it's a milk tooth, or maybe it's a small tooth. Let's talk about it later, or it's not giving him pain, just leave it like that. But suddenly one day it becomes big. So if you have questions regarding how safe is general anesthesia or the full bench, it's very safe. How it is safe? Because we do a lot of protocols. Now, what are these protocols? We do blood test. We go to the bench giving doctor, that is the anesthetist, and they check the child. And if more reports are required, we get those reports. And we finish all the dental session in one sitting, whatever is there. 10 sous, 20 sous, root canal, extraction, filling. We just do that. And then we take care. So if we follow all these protocols, it's a very safe procedure, and your child will have a very healthy smile. See, they are eating from the mouth. So if the mouth is healthy, the overall health becomes healthy, And yeah, like I said, prevention is better than cure. Nothing beats a regular dental visit. And give your children vitamin C. Give orange juice. If you cannot give that, give supplements of vitamin C. You have this in pharmacies, those tablets. You put in water and they bubble up and it becomes a very nice taste. You can take those and give that. And always remember, if the mouth is healthy, the overall child stays healthy. So yeah, that was my small presentation. Any questions, I'm happy to answer.
Thank you, Dr. Garima, for the wonderful presentation. It is very insightful to look at dental health with a new perspective of what we eat, what we need to do after eating, and what kind of food causes risks to the dental health and the bacteria, and the importance of regular dental visits. So I would like to encourage the parents to ask questions. While I take the first question, someone is asking, let me go to the chat box, and someone says that, do you have clinic in Dubai. I think the first line says, if you can just repeat it for us as well as for the parents
Sure, sure.
question.
So these are the places where I practice. If can you see my screen?
Yeah.
Yeah. So this is Sultan Al Ulama Medical Center, which is in Al Barsha Mall. This is True Smile Works Clinic in Dubai Festival City. This is Clover Medical Center in TCOM. Like I said, you can just go on Google and type my name, pediatric dentist Dr. Garima, and you will have all the details here on my website. And there is a call button also. You can just give a call and it goes to my reception and they'll help you out.
Thank you, doctor.
I have a question, please.
Yeah, go
Can I
ahead,
take?
discuss.
Can I
Yeah.
take the question one by one? Because I think we'll just go one by one so that it's easier. Kalpana D'Souza, if you can just open your mouth and open your mic and say the question.
Good morning to all. Dr. Garima, it's indeed a great news that I got to know that our children can have sedation, because my son is 21 years old. So do you also take care of such children, or it's only for pediatrics, just younger children?
No. See, unless if it is a third molar extraction, I take care of everything.
Great. Now, Doc, my concern is Sachio is very skeptical about doctors. Yeah, you cannot even touch him. You can't even touch him. Yes, he's got good set of teeth. Sometimes he bleeds, but I definitely want to have a test done, like you said, a dental test for sure. Now, the question is about you telling. Of course, I think we'll have to go on anesthesia because there's no way he's going to allow you. Now, he will not allow you for the blood test and for sedation. So how do we go about it? It is difficult. Of course, you have to have 10 people to hold him to take out his blood, which we will try and do it. But sedation, to give him an injection, it's going to be a big task. So how do we go about it? Do you have tablets to give him a sedation, or
no?
How?
So I'll tell you how we go about it. So blood test, the hospital that you're going to do takes care of it. They'll call 10 people, they'll hold and get it done. So that is not an issue.
Great.
The sedation part, what happens when we have such patients, we, by 6-10 people holding the patient, we just give an injection in the thigh. It takes 5 seconds. So it's manageable. Once we give that injection in the thigh, the patient kind of becomes a bit drowsy. And then it becomes very easily manageable. We put an IV line and we sedate.
Gosh, Doc, anyway, I will surely come to you. I definitely will come. I don't know how it's going to be. It's going to be very challenging, but I will definitely meet you, Doc. Next week, I'll take an appointment and come and meet you. And thank you. That's all I wanted to know, that will you all be able to take care of these violent children when it comes to...
No, I've had the most uncooperative children. And like I said, that's where the team comes in, where I'm confident of my team, then I don't have to care about it. I've seen the anesthetist, coming out with that sedative agent, and just 5 seconds it takes, one shot in the thigh, and within 10 minutes the patient is like so relaxed. And
That shot is what's going to be a big challenge.
The hospital is full of people for this purpose only to hold.
Yes, if Sachu succeeds, then I'm sure all the mothers here will be happy to know that I've succeeded. So I will keep all of them posted. Okay, Doc, I will meet you sure.
No problem.
Doc.
Thank you. Dr. Garima, you have another question from Karen, who wants to know the schedule in Burj Al Sharjah. And I linked to the question to the another question, which says that sedation is only done in Burj Al Sharjah. So if you can answer both questions.
See, as a special, Dubai Health Authority has a separate rules. Like in our countries, if you are licensed by the government, you can practice anywhere. But in Dubai, as a specialist, you are allowed to hold only 3 licenses, which means I cannot just get up and go and practice anywhere, even though I may have patients there. So I'm licensed to 3 facilities, which means I used up all my 3 licenses in Dubai. So now to perform a sedation, I need a hospital attachments, because clinic does not have hospital attachments. So to get a hospital attachment, I had to take the Sharjah. But I'll tell you what, I was attached earlier to Medcare Hospital in Dubai on Al Safa. And there somehow the hospital was not following the protocols. Like they used to not get the blood test also done or do the pre-anesthetic checkup, which I feel is a very risky thing, because you may never know what comes out in the blood test or the pre-anesthesia checkup. You know, you cannot just sedate anybody just out of the blue. So I was not comfortable with them. And the same thing was there in a lot of other Dubai hospitals, which I don't want to name. But Burjeel Sharjah was very, very particular that we will take care of the protocols, which actually made me feel very confident. And hence, I also decided to stay with them, even though I can switch my license to one of the hospitals in Dubai. But I don't want to do that. Why should we take a risk? You know, it's like driving on a high speed without a seat belt. Why? You know, why not follow the protocols? And I want to follow all the protocols. Hence, Burjeel Sharjah is the attachment. It's 25 minutes from here. And usually when we do the procedure, it's done 8 o'clock or 9 o'clock in the morning. So it's against the traffic. Like I reach Burjeel Sharjah flat 25 minutes from my place in Bar Dubai. It's like anywhere else going to Dubai. So I don't find it a problem at all.
So do you have an idea about how much time does it take to get an appointment from your clinic? About
See, I'll tell you the protocol, how it is done. Step 1, you visit me and we decide, okay, this procedure has to be done. Step 2, I will ask you to get a blood test done. Wherever you want to get it done, from your pediatrician, your hospital, if your insurance covers, or from us in Barsha, we have the facility of the blood test, we do it there. Once the blood test report is ready, you will WhatsApp me the report. I will go through it. If I feel it's fine, then I send that report to the anesthetist in Burjeel. They said, okay, the report looks fine. Now we need to see the patient. So third step, I will ask you to go to Burjeel Hospital in Sharjah and show to the anesthetist out there. I will give you the contact number of the manager in Burjeel and the nursing supervisor. So once you reach there, they will come and they will guide you where to go and whom to meet. So it's a very smooth process. Once the anesthetist sees the patient and says, okay, they basically want to ask you about the medical history, any medications that the patient is taking, or and how the airway is. They might just ask the patient to just open the mouth, like that, just to see if the airway is
No, I
open
will
or not.
drink the all. You.
Excuse me?
Please go ahead, doctor. I think
Oh,
someone
okay.
switched.
No problem. Yeah, so once the anesthetist give a clearance, or they might ask you to get 2 or 3 more reports, like maybe a neurological clearance or a cardiac clearance, if they think that is important. Once they clear, then we fix a date. Usually it would be a Monday, 8 o'clock in the morning, which means that on that particular Monday, you will come 6 o'clock to the hospital in the morning. I would come by 7:45. We start the procedure at 8. How much time the procedure would take would depend how many teeth I have to treat. It can be half an hour, 1 hour, 2 hours, maximum 3 hours. Once the treatment is done, the patient is awake, a little cranky because of the anesthesia effect, but gets back to more and more normal state within the next 1 to 2 hours. So for example, I started the procedure at 8 o'clock and I finished at 10 o'clock. So by 11:30, the patient would be back to normal, like nothing happened, but we are still keeping the child under observation for 2 to 3 hours. So at around 1 o'clock, it's 3 hours after the procedure, we will get a platter of food, the hospital, and the patient would eat in front of us. Once the patient has eaten, we will remove the IV and will discharge you. So by 2 o'clock, you should leave the hospital. So it becomes like a half-day procedure. And then that's about it. So I will give you the painkillers if needed. We also have given the painkillers through the IV when we have sedated the patient. So yeah, that is how the procedure goes.
Great. Dr. Garima, if there is a specific day that you go to Burjeel Sharjah, is one of the parents' questions.
Mondays.
Mondays. Okay.
Not all Mondays, like as in if and when I have a case, because that means I have to leave all the practice out here in Dubai and I'm totally dedicated out there. So it's basically I'll be going just for that patient on that day. So everything has to be booked and then only we proceed.
Okay. I think Nisha Tandon's question has been answered. She needs to get a checkup done and then she will be able to contact you with the contact details that we will share with in the presentation. Shahad, do we have any questions from the Arabic parents? If you can just open the mic and let us know.
Sure, Stephen. Actually, no one asked.
Okay.
Doctor, I have a question. Is it possible, for example, if the child has 2 or 3 teeth has been affected and we can do it in separate days? Is that possible?
Under full sedation, that is not possible. You cannot sedate a child 2 or 3 times. But if you want to do on the dental chair, basically the dental clinic,
Mhm.
that is possible, but the child needs to cooperate. If the child is not cooperative at all, then it cannot be done.
Yeah, I don't think so. He's corporate. Yeah, so
So
maybe
then,
in one day. Yeah.
yes, exactly. And that is, you know what? See, I
Mm.
understand there would be hesitations regarding the general anesthesia. But
Mhm.
trust me, it is so comfortable to the patient because they are not resisting. They are not having that trauma that somebody is forcefully opening our mouth or somebody is holding us. They are peacefully sleeping. So everything gets done very efficiently. It's not like you're holding the child trying to do something which may or may not happen properly, you know. So it's always better that if the child is uncooperative and there are more things to be required, treat under general anesthesia.
All right. Okay. Thank you, doctor.
No problem.
Great. I think you were the same person who was trying to ask a question when I asked. We'll go by the sequence. So I'll move to the next question. Where is the blood test done? I think you can do it anywhere that you like your insurance cost or in the clinics that Dr. Garima sits. Is that correct, Dr. Garima?
Correct. I will tell you which blood tests are required.
Yeah, sure. So that's after your consultation, after you see the child.
Correct. Because it depends on child to child. Not every child will require the same set of blood tests, you know.
Great. Mr. Kuram Abbas says that this was a very informative session. The Fatami to everyone, she says that thank you for your honesty. And Samira wants to ask a question about the Al Barsha clinic time and do they need to take an appointment before they visit you?
Yes, of course. The appointment would be needed because we have a lot of appointments. Like I said, if you could just type my name, Dr. Garima, in Google, there is a call button. If you click, it goes to the reception. So just call and ask them, we would like to book an appointment with Dr. Garima. And the reception would give you the dates and the timings that I'm available. And whichever suits you, you can just book an appointment and come over.
Anju Sareen has a question in which she's asking that can the blood be extracted by the child is in the car? So is that possible?
I don't think so because see what happens is the child needs to come and you have to have that setup because immediately as you extract the blood, you need to put in some ampules and 2-3 people would be needed to hold the child. It would be very difficult to hold the child in the car and do all those things because if the child moves in here and there, he might injure himself because of certain things, or the assistants would have a different unfamiliar environment out there. They may not be comfortable or something may fall down or something extra might be required which may not be accessible at that time, you know. So I don't think so. But you can always get the child in a wheelchair or something if you would like. We are not asking the child to move somewhere. We can manage the child in a wheelchair or any seating arrangement that the child is following at home.
Karen wants to know that which day do you sit in True Smiles work for consultation?
Saturdays only, Festival City.
Saturdays only for True Smiles in Festival City.
Yeah.
What is the timings, doctor?
See,
In-
the
on
timings are
Saturday?
from 11:30 to 6. But like I said, the other patients are also there appointed. We see on appointment basis only. So it's always better to call the clinic
Book
and
appointment.
fix
Sure.
the time and then. Yes.
Sure,
Because
doctor.
Saturdays, you know, are very hectic days. A lot of parents want to come on Saturdays only.
Yeah, Saturday also it's good because children are off. They don't have school.
And that's why I work, even though my family says it's a weekend, why I'm working. I'm like, I feel responsible. That's why I'm working.
Yeah. And doctor, you want to show us earlier regarding that when brushing the teeth for our
Bite block,
child?
yes. Can you see my
Yes.
screen? No,
Yeah,
screen
doctor,
share.
we can see your screen.
You can see this colorful things.
No, doctor, I can only see the location of your practice.
Oh, okay, wait. How do I on the screen sharing? New share this.
You
Share.
can click on the share screen and then
Yeah.
choose the, yeah.
Now you can see
Yeah.
these colorful things.
Yeah.
These are called as bite blocks. So you see, you take them and you, let me see bite block.
Okay.
So you see how it's put in the mouth here in this picture and this picture.
Yes, doctor.
Yeah. So this is how. Yeah. Yeah. This is a good picture. Yeah. This. You can see my arrow here, right? So you put this in the mouth like this. So what happens? The other side now is enough open for you to put the brush and clean properly.
Yes.
Correct?
That is the main thing. No, we cannot insert the toothbrush to that part because my son is biting the toothbrush.
True, true. So when you put like this, he cannot close the mouth and it's big enough. So don't fear. He will not swallow because it's big.
Yes.
So you can easily clean. If I may go as far, let me suggest you, I don't know if you can manage to get your hands on it, which would again reduce a lot of things.
And doctor, which toothbrush is suits our children for like the soft one or?
Yeah, can you see this? So,
Yes.
yeah. Now I understand they don't rinse their mouth, correct?
Yes.
So something like this, you know, I think this is a better one. What you can do is when you're putting water and there is after brushing, you feel, you know, the child needs to spit out, but he cannot. You can use one of these. You can just put a wire on the machine and it will
the suction pump.
Yes,
That's like you
yes.
used in the clinic.
Yes, yes.
Great. Okay.
So you can take a bit of water, you can brush nicely, and if there is a lot of saliva and the child feels like he's going to gag, you know, you can just put the suction, take off all the things.
Okay. I think we can find this in Amazon. It's in
I
Amazon.
think 100 dirhams is good. I think it's nice. I mean, this is a Felgam one, but I think you will get it for even lesser if you can search. You know, I've not searched, but this is also good. Nice. I mean, just plain plastic tubes. You know, you put and on the machine and it starts.
Yes. So any toothbrush, doctor, that you can suggest for a 17-year-old child?
Yes.
Boy?
I will suggest a toothbrush which is good for the entire family. See, normal toothbrush is made up of nylon. That gets frayed after you use. If you would have seen your own toothbrushes, you know, they become like this. But this toothbrush is made up of curane filaments. You know, this is for everybody, regardless how you are.
Yes, yes.
So this curane filaments don't fray because they don't absorb water. So they remain like this for the entire year, and they are so nice and soft that even if you brush a little hard, it will not damage your gums.
Okay.
So, and this head size is just appropriate to go even on your last teeth. Otherwise, some toothbrush, you know, have very big head size, you know, it hurts out here and here.
Yes.
But this easily goes and you can brush very nicely. You know, just buy this once and you'll see the difference. Instead of buying those 20 dirhams toothbrushes 4 times in a year, buy this just one, which is again like 24 or 25 dirhams only, and it will last an entire year.
Can a 3-year-old also use this, a 4-year-old child, doctor, this toothbrush?
Absolutely. I would recommend this since the start of the brush. Use it for 2-year-old, 3-year-old, 4-year-old, no problem.
Great. Now, any toothpaste, doctor, that you can suggest?
See, with regards to toothpaste now, my genuine suggestion would be if your child cannot rinse, they cannot do mud don't use a toothpaste because they will swallow. So basically you're feeding chemicals. Brush only with water. But if you want to use a toothpaste, you can use any adult toothpaste which has a bit of fluoride. This much amount, only this much, and you press it inside the brush and then
Okay,
you brush
sure.
like that.
Fluoride. Any brand, doctor, for that
All
fluoride
of
thing?
them have the same. The fluoride thing, I've sent the link. So I think he's recorded this presentation. You know what? Let me show you the fluoride. If you go on Amazon and if you just type fluoride varnish.
That fluoride earlier, yeah, I took that picture already.
Yeah. So if you search here,
Here, okay.
yeah, I mean, don't buy this entire 50 pack. There is a 3 pack which is just for 99 dirhams.
Doctor, we
This
are
one.
using algidium for entire family. I think algidium is good.
It's good, like, but it has the same ingredients like any other rest of the toothpaste. If you compare, it's just marketing gimmicks.
Shall we move to the next question, doctor?
Sure, sure.
Yeah, so that we can be able to take as many as. So do you have evening consultations also, or is it stops after some time? Like what time is it in the evening most suitable?
See, weekdays I'm working from 4 to 9. Like, for example, today I'll work from 4 to 9 because I understand the schools finish at 3. So I'm working after that. Weekends I'm working from 11 to 5, like that.
Okay. Okay. It answers Aisha Sharur's question. We move to Camilla's question. My son is not cooperative for dental procedure. We wish to do teeth cleaning for him. May I know if sedation is required to undergo the process? We do not have insurance coverage. May I know the approximate cost of tooth cleaning?
Okay. See, first of all, teeth cleaning sometimes can be managed on the chair, even if the child is uncooperative, but it depends on child to child. I cannot promise if I can manage on the chair without seeing the child. Cleaning coverage in the insurance depends on your insurance. So if you're coming with insurance, I will have to send it for approval first. So if it's approved, then it's covered. If it's not approved, then usually it's around 350 dirhams or something.
Good. Thank you. I think that's very clear. Shahad, can you help me with Fatima's question?
Yes, Stephen. She just wanted to see the tool which the doctors used to open the child's mouth, which is already was shared the photo.
Okay, okay. I think that's already answered.
Actually, there's another question, Stephen.
Okay.
They wanted to know if in the case of the child has so many teeth needs treatment. So can that be done in one session?
Doctor, can many teeth can be treated in one session?
In sedation, as many teeth as possible. Yes, as in we treat all the teeth in sedation in one session only. I mean, if it's just a simple extraction, filling or cleaning, adult root canals will not be treated because they require multiple sessions. In such scenario, I would, seeing the condition of the child, I would say extract the tooth. Don't keep it in the mouth.
I think there is a question for how much is the cost. It would be specific for what is the cost being asked. It would be helpful for doctor to answer. In the meanwhile, I'll take another question. And is it better directly to go to Sharjah or a clinic in Dubai first to meet you?
First, you have to meet me. How would you know where to go to Sharjah and what to say?
Okay. So they meet you in Dubai first?
Yes.
Okay, great.
Yeah,
and to discuss the cost and all. See, yeah, let me come about the cost of the sedation. Okay. I understand that Stephen must have told you, or you are aware, or you're not aware. So this Ramadan, we have started this initiative of providing free dental care to one child every month. So let me tell you how that works with the initiative, and let me tell you how it works without the initiative. So example, you have come to me in the month of June and your child requires, say, 5 teeth which require treatment. Now, example, the dental cost, which means the treatment that I will be doing, comes to somewhere around 3,000 or 4,000 dirhams. And then there is the sedation cost, which means the hospital cost of the Burjeel hospital. That is calculated hourly basis. So for 2 hours, the cost out there would be around 5,500 dirhams, because they charge how much time we take inside the operation theater. So your total cost now becomes 5,500 plus 3,000. That is the anesthesia cost and the dental cost. Now, with my initiative, once a month for one child, I waive off the dental cost, which means that the 3,000 dirham that you had to pay for the dental treatment, you don't have to pay that. You just have to pay the hospital cost. If you are coming without the initiative, as in I've already treated one child for the month of June and there is something urgent and you would like me to treat your child, you know, then you would have to pay the dental cost also, because the clinic has its own expenses also. So once a month, they have allowed me to waive off the dental cost of one child, but more number of children, then they end up paying the dental cost as well. So Burjeel cost would always be there, because that is a hospital cost and the hospital is not waiving any cost. I'm waiving the dental cost from my side. I think, is that clear?
No.
Shall we move to the next question?
Yes, please.
Yes. So then, if a child has more than one tooth which needs treatment, would it be would it be done on the same day? I think you've answered it in the beginning that it can be done at the same day. Is that how it is?
Yes, yes.
Okay. And also, Fatma wants to know that I think you've answered that the tool which is allowed to keep the mouth open while checking his mouth or her mouth. Is that something that you've already answered in the beginning, I guess?
Bite blocks, you can search on Google, like I search. It's 49 dirhams, 3 blocks you get. Very good. You know, even I did not know it's easily available. I thought only dentists can achieve it.
Yeah. So Shahid, the name is Bite Blocks. We can inform the parents accordingly. How can we book with you for sedation for daughter Shams, please? So they want to know if they want to book a sedation, they have to, what do they have to
First,
do?
they have to visit me, understand the protocols, the pros and cons, and what treatment is required, how much hour it is going to take, the cost factor. Once they agree, then they get the blood test done, and then we book the procedure.
Great. Do you accept Madahla insurance?
Al-Madala insurance. All the insurances are only accepted in my Al-Barsha Mall clinic, Sultan Al-Olam. The rest of the 2 clinics are on reimbursement basis only.
You have touched upon this question about swallowing toothpaste. Is there any harm in swallowing toothpaste? My child doesn't know how to spit.
See, what happens, the toothpaste has a lot of chemical ingredients which usually cause stones in the kidneys. Hence, if your child cannot rinse, I will definitely tell you, don't use a toothpaste.
Great. The next question is, I am using water flosser cordless air jet dental. Is it safety to use it? Is it safe to use it?
It's a very good device, but you see that cordless has a lot of pressure of the water when it comes out if you use it in your own mouth. So you have to be very, very careful if you're using in somebody else's mouth, because if you don't keep it at the right distance, it's going to damage the gums a lot and it's going to cause a lot of pain. So only the person who's doing in his or her own mouth should use that. You should not use that in somebody else's mouth.
Yeah. Will you be able to please repeat the toothbrush specification again? I think the parent is asking the name of the toothbrush.
Curaprox 5460 Ultra Soft, or I'm writing here in the message itself so everybody can see.
Great.
Curaprox 3960 Super Soft. This.
Yeah. So you've already mentioned, and we would like to inform the parents that you are kind enough to provide a dental service free of charge for one student a month. If you can just, kind of repeat that what you said so that it's
Yeah,
clear
see,
to all the parents?
the consultations when you come to me are paid because you are coming in the clinic and the clinic charges for that. But if you are doing the treatment under sedation, there are two costs. One is the anesthesia cost, which means the hospital cost where the child would be sedated. And the second cost is the doctor cost who's treating the child. That's me. So once a month for one child, the dental cost is waived off, but the hospital cost still remains. So that is the initiative where no matter how much is the dental cost, I waive it off for one child every month. Like for this month, already a child is booked. We are due to treat her on this Monday. So her total cost of the dental and the anesthesia was coming to somewhere around 15,000 dirhams. 5,000 being the anesthesia cost and 10,000 dental, but I waived that off because she's the child of the month, like that. Understand?
Great.
Ma'am,
Mhm.
I have doubt. This Adnic NAS comes under insurance, ma'am. This dental coverage.
We don't accept ADMIC. We accept Neuron, NextCare, NAS,
Okay.
Almadala. And these, I'll tell you what, all these have dental insurance just to the extent of 3,000 dirhams. And
AXA, ma'am, you accepted?
no, we don't accept AXA.
No AXA?
No. But I'll tell you what, no matter what insurance you have, the anesthesia part, that is the full sedation part, is never accepted by any insurance. So even if you have insurance, it's useless.
Aisha Sirur wants to ask that do you just do cleaning for teeth or are there other facilities such as braces?
Yeah, we have all the facilities. It depends on what is needed.
Okay. So parents, we are requesting you to put your feedbacks on the attached form. This is very important for us to know that how the session was and we can give the feedback to the trainers and for us. The next question is it covered by insurance? As you mentioned in the past, there are certain things which are covered by insurance and which are covered by specific clinic. Will the hospital cost be waived if the child has insurance?
No, the hospital cost is fully on cash reimbursement basis.
Okay. The next question is quite interesting. Is vibrating toothbrush better than manual toothbrush?
Electrical toothbrush actually were made for specially able children because we understand that the motions cannot be done by such children. It's good, but you have to still make the movement of moving the toothbrush from one to the another. So if your child is comfortable with that, you can continue to use that, no issues. But it's better than the manual one? No, both are the same.
Right. Is Oman insurance accepted in your clinics?
No.
No. I think we're just in time. We've finished all the questions. A few thank you note for you and very useful information as mentioned by the parents. We will share the presentation with the parents if you allow us to do so, so that they have the information.
Please share the presentation with me also. I would like to put it on YouTube. That would help a lot of other parents to get the information.
Doctor, I have a question.
Sure.
Ma'am, which toothpaste do you recommend for our kids?
Anyone is fine. Trust me,
Anyone?
all have the same ingredients.
Okay.
But
Okay.
use the adjuncts that I'm telling you to use. Because like I said, toothpaste, the child may swallow. So it's not that great. But fluoride, GC tooth mousse, Pet and Fisher sealants, they are excellent.
Okay, fluoride, so once in 3 months we should apply?
Yes, please. And you'll see the difference. You will see the difference.
Okay. First thing, thank you so much for this golden, what I don't have words to name it.
No problem.
It's such a blessing for
You're
our children.
welcome.
Thank you, ma'am.
Thank you so much.
I think
Thank
we're
you.
on 11:29. I think most of the questions are done. We again request you to put your feedbacks on the form so that it doesn't stay verbally on this. We have the documentation for it.
Yes, I would like to have your feedback. Please share with me also how they felt.
Doctor, one last question. One last question before you go. Would you
Would you
advise?
advise using teeth wipes for oral sensitivity? Teeth wipes are for cleaning teeth. They would not help you much with sensitivity, but fluoride will help you with sensitivity. See, you have to understand why sensitivity is there. It's because the second layer of the tooth gets exposed to the oral cavity. Fluoride will block that layer. Wipes are not going to block that layer. Wipes are just going to clean from the top. So fluoride again is the answer of choice here. It will reduce the oral sensitivity.
Can I just clarify? The question was that teeth wipes to be used in between till oral sensitivity is being worked upon, like as an in between measure where they don't tolerate toothbrush and toothpaste. So before the use of even the new brushes, the sensitivity is so high. So would the teeth wipes be helpful in that stage?
Teeth wipes would just help to clean the teeth, but the sensitivity is because
not towards sensitivity, to keep the mouth clean.
Oh yes, that's what. Either the teeth wipes or you wrap a cotton and dip it in water, a cheaper solution. Teeth wipes is good. They cost you like 30 or 40 dirhams for 50 packs. They get used up very fast. So I would suggest buy a big pack of gauze, cut into pieces, take one, dip into water, throw.
Okay.
There you
go. All right. Thank you.
Yep.
So we wind up with a note that Kalpana has just written. It is indeed boon knowing you, Dr. Garima. It's great. It has been a great concern and you are such a relief. We'll meet you soon. Thank you, Noor, for this introduction. Well done. Thank you, Kalpana, and thank you all the parents. Thank you, Dr. Garima. We'll keep this association on for helping the parents who need solutions like you provide. And have a great day.
Sure. Bye. I would look forward to you sharing the recorded presentation to me, okay?
Yeah, sure.
Thank you. Thank you. Have a good day, everybody. Bye-bye.
Bye.